Good day and welcome. Today we're going to be talking about public speaking, but also the very important issue and topic of cultural competency, so that we as physicians, medical students and nurses move in to help educate our community. We can be effective, empathetic speakers who are able to connect and make a difference in the health of the communities that we serve as we speak publicly. Today, we're very fortunate in having our two fellows in faculty development at SUNY Downstate, Dr. Edward Allen and Dr. Monica Grover. They will assist me in discussing public speaking and how we reach out to our community and prepare ourselves. In addition, though, we have two experts in cultural competency, Dr. Singleton and Dr. Donat. Welcome, and I hope you enjoy this segment of faculty development, public speaking, and cultural competency. Dr. Allen, it's great to have you back again, and we have Dr. Monica Grover. Our two faculty development fellows are here in geriatrics and in women's health. Welcome.
Thank you.
As physicians, we're often asked to go out and speak to the community. We want you to be successful, and success is where opportunity meets preparedness. What goes along with that? With the opportunity always comes a
responsibility.
Yeah, responsibility. Mm-hmm. And how do you prepare yourself? And that's what we're going to talk about today. Public speaking, how can you be effective? What are the things you need to think about and know before you jump into this? So we are fortunate. People want to hear from us. You can speak to a PTA at a community church. So I guess the first thing I need to tell you is that you need to know your audience. So Ed, who was your audience when you went out to speak?
These are people who live in the communities surrounding the churches.
Mm-hmm.
So topics range from hypertension, diabetes, asthma.
Mm-hmm.
These are just some of the topics that I had to speak on.
Great. And Monica, what were the topics and what were the groups you've spoken to?
I've spoken to first and second year medical students, lecturing them on topics that were relevant towards their education.
But you've got to make sure you deliver the message they need.
Mm-hmm.
Yes.
Something they can understand, something they can use, something that's relevant, and you deliver it in a way that's effective. And that's why cultural competency becomes so important. Maybe the first step in how you're going to prepare yourself is getting to know and understand your audience. And for that, in addition to our two great fellows in geriatric faculty development and in women's health faculty development, we have two experts that are kind of speak about cultural competency, and perhaps we'll come back and use the cultural competency and look at how we can effectively deliver a message as we engage in public speaking with our community. We have Dr. Joanne Singleton, an expert in cultural competency. So we're really proud to have you here this morning, Dr. Singleton. And Dr. Margaret Donat, who is our assistant professor and our director of residency training in the Department of Family Medicine. And both of our speakers this afternoon have been involved in cultural competency activities within our communities. And we turn to cultural competence because it's that thing that helps us to be effective, to be respectful to the community, and be able to build a trust, develop rapport with a real two-way communication. We begin with the discussion of what is culture, and culture relates to groups of people who interact together that have a common set of both values, beliefs, and assumptions. Well, why is this so important in public speaking, Dr. Singleton?
Every time we have a group of people come together, we have different cultures coming together. We have cultures within cultures. Culture is completely active in the world that we engage in and in our public speaking. So having a sense of who that group of people are is going to help us to know how to communicate and how to be respectful and how to shape that important communication.
We bring our culture as public speakers, and sometimes the culture of our community is the same and sometimes it's different. When it's different, have we sort of altered or changed culture? Is culture something that constantly changes?
I think that culture is something that is evolving, and that within, when we think about culture, we often think about Margaret Mead's work, an anthropologist, and we think about ethnicity. But that's just a piece of what culture is. So your discipline is medicine, my discipline is nursing. We both are culturally influenced by our professional disciplines. When we are speaking with an audience, within that audience, we may have people who are ethnically representative of a cultural group, but then within that there are going to be some subcultural groups. So the challenge for us in public speaking is to recognize that people from cultures have shared things, people from different cultures have differences, and to respect the differences, but to look for the similarities as to what makes them a group and why they're there to hear what we have to say, because that's going to help us then to understand the best way to shape that communication, to have a two-way communication.
Great. Dr. Tanat, you've done a lot of work around here in the Haitian community, speaking at churches, doing work on cervical cancer prevention and education within our churches. But you also went in 2010 to Haiti after the earthquake. Both are Haitian peoples, both speaking Creole. What was that like for you as a physician?
The difference is that, like here, when I talk to the Haitian here, I would talk more like if I were to talk to an American, but also remembering they are Haitian, the culture might be different in certain aspects. So if I go to the churches here, I talk to the population, it's even though I'm going to give them the same message, but it may be different. You know, it may be different in a way. They don't have the same access here. They don't have the same, you know, the disease is going to be different, you know, because like we said, you know, like prevention, they are population specific. Because just because they're here now, they're going to have almost the same diseases as the American, versus when I go to Haiti, like after the earthquake, for instance, this population is different. That population in Haiti I talk to, they have nothing. It's not like I cannot tell them to go get this, get that. You cannot give them a prescription to go to a pharmacy because they have no access. They don't have anything. So you're going to talk to them about how to prevent from getting certain diseases like the parasitic infection, and also, you know, how to get clean water, and, you know, what's wrong with drinking that water, what could happen. You know, it's going to be more prevention.
So you reached out, made women comfortable, educated them, and then offered your own services. So you certainly set up this two-way street of communication and service. And the question that I think we all look at is, what was your community? And you knew what your community was. And I think you also are telling us a little bit about the determinants of health. Part of the determinants of health is culture. Where are you coming from? What resources do you have? What are your beliefs? What's your belief system? What's the history of health? And it's what other forces do you have, what resources do you have that get brought to you. But in addition, part of your determinant of health has to do with your past. What have you learned that's good? What have you learned that's bad? And if you're in a culture where all sex is bad, unless it's for having children, you're certainly going to have more of a challenge in trying to bring those women to a preventive care system that involves something like a pap smear. One of the things I thought we might tell the fellows in order to be able to understand the culture of the community that they want to communicate with is to understand the cultural guides. And being a physician helps sort of enhance that role. But who are the other cultural guides in the community? For example, when you get involved with churches, do you often speak with ministers beforehand?
Oh yes, we have to. You know, you talk to them, let them know what you're going to talk about, when you would like to come, or they may tell you this is the first Sunday of the month, it's a very long service, you come the other Sunday, or, you know, it depends. You work together with them. Yeah, of course, you need to communicate with them.
And what do they tell you about, or what can the cultural guide, somebody like a minister or a priest, tell you about the community and what they want and need to hear?
Usually, I mean, the church would know more or less what kind of population they have, you know.
We just don't stop with the doctors and the nurses and the ministers. As we look at the cultural guides in our community, we look at the folks in the community that our patients depend on.
I know that my colleague is a fantastic cultural guide for us here in relation to working with the populations that she's working with. And it's very clear that some of the attributes of cultural competence is what she lives and breathes. So being self-aware, being reflective, starting with the self, because we know that cultural competence is never an end point. It's a being and it's a becoming. So each time you're working with a new group, you're looking again at yourself and you're saying, what do I know about myself? And now what do I need to know about them to be able to move all of this forward? And so it's this never-ending, ongoing process.
Part of the formula for success is working collaboratively with our cultural guides. But one of the things I found in working with the community is every once in a while, you find participants with their own agenda that don't necessarily reflect what the community had in mind. So I call that the beware item. And you have to make sure that if it becomes too self-serving, the community at large has to be served. So if his ratings go up, doesn't hurt you. No. But if you get a few more people in the community that will survive or be diagnosed with colon cancer earlier so that they can be cured, it's worth it.
Yes. Mm-hmm.
So I think what we heard Dr. Singleton and Dr. Donat say is understanding your community, reaching out to the community, knowing yourself, knowing your strengths and your weaknesses, understanding that cultural competency has no end point. It constantly changes and evolves. And that part of what we're looking at is folks to be self-aware, learning from each other, and learning is really changing behaviors, both cognitive, things that you kind of know, affective, how you feel about things, or the issues, and understanding how your community feels about them. And then there are always those skills, those psychomotor issues that you develop. But one thing you also have to be very aware of is how others perceive you, because it's really all about your audience as you reach for the stars, because everybody wants to be successful. Mm-hmm. As you're getting up there giving your message, are people pinching themselves to stay awake, or you're really talking about what they want to hear? And are you really seeing eye to eye? Are you doing the things? Are you discussing the issues? Are you approaching the topics that your audience really wanted you to? And how should your audience see you? And Dr. Singleton, you touched on this, that you want to come across as confident, but not so confident that you can't connect. You have to be careful. You want to be self-aware. You want to be the expert, but at the same time, you want to be a human being so you can connect.
If we look back at the history of teaching, and we think about Socrates, 2,400 years ago, we would find him in Athens, we would find him in an olive grove, sitting with 15 or 20 of his students in a dialogue with them. So now we fast forward to 2012, and we talk about death by PowerPoint, and we talk about all of these different tools that we have that can be very, very effective, as long as we always remember that it's the dialogue and that different audiences will receive that important message in a variety of different ways, and that cultural guide is going to help us to understand the best way to deliver the important message. Because if we're accepting an opportunity to do public speaking, it's because we care about something, we believe in something, we want to communicate something, and we want the people that we're speaking with to be able to use that information.
Thank you both so much. I think this has been a wonderful discussion on cultural competency, and now I want to see how our fellows are going to use it as we move on to public speaking. Thank you.
Great. You're welcome.
Thank you.
Well, welcome back to our fellows. I guess this seems to be getting a little bit more complicated than you thought, huh?
A little bit.
A little bit, because you're thinking about how you're going to multitask and take this all in. Well, fortunately, before you speak, I think you've learned that there's some groundwork you have to cover in terms of cultural guide.
Speaking at church health fairs, would have to speak with the pastor first. One of those churches was a church I regularly attended, so that was easy. The others, I spoke with the person who was in charge of the health fair. It was usually one of the ministers, the other ministers in the congregation.
Sometimes nurses in the church will run them very often, very common in our neighborhood, right?
Yes.
So we've got to be prepared ahead of time. What's the culture of our community? What are they looking for? Who's the culture guide? What's behind that request, that opportunity to go out and engage in public speaking? So we left off with, how do you project? You is the speaker. So what kind of dress? I mean, when you went to the church, did you wear your dungarees and your sweatshirt?
For the health fair, yes, because there were basketball games, other fair games going on at the same time. It was a more relaxed environment, and I wanted to sort of show myself as one of the people speaking to the people.
How about when you were standing in the front of the church?
When I'm standing in the front, I had my blazer on. Without a tie. It was sort of business casual, and some slacks. So it was a different situation
You were
at that
more
point.
professional in your
Yes.
appearance. Monica, how about you when you went to speak with those medical students?
I always dressed very professionally. I mean, I needed them to take me seriously in that environment. So, you know, I mean, some of them are just as old as I am, or, you know, I just need to project myself in a different manner. So it's very professional attire.
And as you prepare and think about, because you're going to think about what you're going to say and how you're going to say it beforehand, I'd like to remind both of you, so you don't go kind of wandering all over the place, that a talk has 3 parts: a beginning, a middle, and an end. And a beginning is not only an introduction, it can be something exciting. So if you want to talk about community-acquired pneumonia, you might want to open with the Legionella epidemic, rather than saying, this is the list of bacteria that can cause community-acquired pneumonia, right? So it's kind of get your audience interested in, like, can this happen to me? So sometimes you begin by bringing that group back to where they wanted to be. You have to introduce yourself, not only who you are, but why you're there. And to say, I'm honored or I'm humbled by being asked by this community to come and talk about pneumonia. You have your beginning where you introduce yourself and the topic. You might want to ask an exciting question or a thought-provoking question. So Ed, how did you begin your talk?
Who in the audience has a relative with or themselves have hypertension? And I had people look around at the hands.
And there were a lot of hands up.
There were quite a few.
And then you can say, now I know why you wanted to know something about hypertension. Where does it come from? So now, in your beginning, you're giving a rationale, a background, you're laying the groundwork, you're introducing yourself. In the middle, that's where you give the meat of the message. Where is it coming from? How can you prevent it? Because that's what people, and if you get it, what do you do? And then in the end, I always think about Dr. Carroll, who was a very famous professor here. And he used to talk about when he came to lecture to medical students, he says, you know what? I tell them what it is, I review it, and then I tell them what it is again. So you want to sum up in the end and really give them a message to your community in a way that's relevant, but it's also inviting to ask questions. So you use it as a teaching point, you review it, you reframe the question, you make sure everyone understands the question and in fact has heard it, and that becomes important. So sometimes I found, you know, I go in prepared, I have my beginning, my big punch, the introduction, getting everybody involved. You know, I get through to the end, I figure, what a great talk that was. I think people probably learned. And then during the question session, I realized how much more folks have learned. Repeating the question, giving examples, using the information that you just delivered in a very effective way, sometimes explaining it in that way. And that's how you learned in medical school, right? It's one thing to explain the medical molecular scientific basis, but it's another thing to add, oh, that's what you meant by that. And that's the kind of response you can elicit in your audience. What do you mean by engaging your audience? What are you doing as you're walking throughout?
You're keeping their attention. You're having
How do you know?
Well, you could see if you're walking through, you can see if their eyes are following you as you're walking back and forth. And
You're looking at body language.
Right.
You're looking at eyes. You're looking at position. So you respond to different types of language. One language might be a question that you repeat and reframe and use as a teaching point. But another kind of response may be body language. And that's, use it. Use it in a very respectful and productive way. Now, you brought up a very interesting point, Ed. One of the things you said was, for you, it was important in the church to deliver that personal message. So you didn't go in with slides. Monica, when you talked about endocarditis, you went in with slides prepared. You can use overhead transparencies. Here we use the computer as technical backup. How are you going to decide what your audio-visual aids will be? Because the first thing you do is stop again and think about it as part of your preparation. So how do you decide? How did you decide to use slides? And how did you know that they learned from slides?
because when I was a medical student, I know that I like to have slides, and I like to use it as reference points. So when I opened up my textbook later, I would know exactly how to correlate the information for the exam. Versus when I went to the junior high schools, I didn't have anything. My other colleague and I, we did a little skit, and we pretended one of us was a patient, the other one was a physician, and that's how we grabbed their attention. And then it was just a simple question and answer session afterwards.
You are still the teacher. You are what counts. The slides are only an aid, and it is death for any presenter to stand there and read the slides. Meanwhile, you are so disconnected from your audience, they may as well be on Mars. That message is going nowhere. They're going to walk out of there saying, that crazy lady stood there and read those slides. That was the most boring thing, and I didn't understand one thing she said. So you have to, you pay a price when you use these audiovisual aids, and you're kind of balancing the benefits and the risks or the downside of using them. You want to think, you want to prepare, you want to rethink, you find yourself going back and checking the facts. You may also, though, want to role play. So one of the things I did for years was pay my granddaughter so I could present to her. She'd say, Grandma, you're not really going to say that, are you? And then time. And that's where Renee comes in. That's her name. Check your performance. Mm-hmm. So sometimes I'll have our fellows present to me, and I'll play the role of the resident. When you went in to talk about hypertension, Dr. Allen, did you talk about the entire breadth of hypertension and JNC7?
No.
And no, I
Absolutely
can't imagine
not.
why not.
No.
Absolutely not. Why not?
I would have lost my audience instantly.
Yeah.
Yes. It was beyond the scope of learning for the patient learner at that point.
Right. You'd have had to distribute no-dos beforehand. So one of the things is understanding your audience, being culturally sensitive, understanding what it is that they're looking for and how to deliver that message. And again, time. And we are running out of time. But remember that practice makes perfect. And we really want to thank you for your attention and caring, because we've got a whole group of medical students now here at Downstate that need to go into the community, and they just want to rush right in, and they want to make slides and PowerPoints because that's how they teach each other. And they need to really think about who they are, their role in their community, how they're going to get the message across, how they can connect with cultural guides to really understand what a community is looking for and how to effectively give the message. So if you looked at one big talking point or message that you would want to give to these medical students, what would you tell them, Dr. Allen?
Know your audience and what is appropriate for your audience to learn.
Well, I have to tell both Dr. Allen as well as Dr. Grover that it has been an absolute pleasure working with you as we discuss public speaking. Whether you're in front of a church, a daycare center, or with a group of medical students, when you're out in your community, you need to know your community. And I feel particularly empowered to work with such great fellows here at SUNY Downstate in the area of faculty development. And I'm pretty confident that our medical students will be far more effective having watched this video. So thank you very much, and you all have a great afternoon.
Thank you.
The opportunity to speak publicly is a wonderful opportunity, but it comes with the responsibility of understanding your community, the culture, the values and beliefs that are held to be important by that group of folks. Not always such an easy task because culture is constantly evolving and changing. You've also got to think about what you're going to say, how you're going to present it, how you will present yourself to best communicate the information that our community wants to know, understand, and use. It's a great opportunity. I wish all of you well, and I'm confident that our community here at SUNY Downstate will benefit from your efforts. Thank you so very much.